If you are getting ready to go on Medicare this year and you are a woman, the good news is women will pay less for a Medicare supplement than a man. Men don't like that, but women take our health a little bit more seriously than men on average. If we get something, we're going to the doctor, we're getting it checked out. Men typically ignore it until it is much more advanced. Insurance companies see the data and charge men more. So let's look at Medicare supplement plans in general. You have a lot of different options, and we call it alphabet soup, ABC, blah, 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 blah. What you need to know is that there's really only a few plans that anyone actually purchases, and by far, most people will purchase Medicare Supplement Plan G. You can't buy an F. Sometimes we sell a Plan N. Most of the other plans, no one ever buys. So what does a Medicare supplement actually do? If you buy a Plan G, we call that a Cadillac plan. That's what I will buy when I turn 65. I'm only 58. That's what I have my parents on. That's what I want all of our clients to buy if they can comfortably afford it. And there's no budget shaming if you can't afford it. But if you can, and it's typically very affordable at 65. If you can, we want you to get a Medicare supplement. How does it work? The Medicare plan, Medicare A and B, we call government Medicare, original Medicare. When you go to the doctor, they're going to pay 80% of your costs. You have a deductible and you would pay 20%. Now, if you have Medicare Part B and you only have the government Medicare A and B, you could have an unlimited amount that you would pay out every year. Let's say you have cancer and you're going to go get chemotherapy and radiation. You would pay 20% for every one of those treatments with no maximum. There's no, you could be out $50,000, you could be out $60, $70, $80, $100,000 based on how much you are going to the doctor and how expensive your treatments are. Do you need a transplant? What's 20% of that? So it's very expensive to only have government Medicare only. Most people will supplement it. People that can afford to will buy a Medicare supplement. Now, a Medicare supplement is necessary because of all the things that Medicare, government Medicare does not cover. It does not cover nursing home, long-term care. It doesn't cover routine vision. It won't give you an eye exam. So people that buy a supplement often buy separate vision coverage. It won't cover you at all out of the country. Well, okay, it covers you a little bit sometimes, but for my intents and purposes, it's not covering you out of the country. It doesn't cover any dental at all. Nothing, not a cleaning, an x-ray, an extraction, and definitely not the expensive stuff, a root canal, dentures, implants. Again, our clients will buy separate dental insurance. It does not cover hearing aids, which can be very expensive. It doesn't cover cosmetic surgery, and it won't cover your prescription drugs. So you'll buy a separate drug plan to cover your medications. I had one lady mad at me one time when I was explaining to her options because she just wanted government Medicare. If government Medicare Part B this year costs $174 for the average person, that's a chunk of change right there. Plus you're paying for your drug plan, plus you're paying a copay for all your drugs. She goes, that's a lot of money. She goes, why do I need something else? Why do I need a Medicare supplement? That's what I said. It supplements government Medicare. It will fill those holes if you get really sick. That's when you'll find out how valuable it is. If you're healthy and you go to the doctor twice a year, you're paying your deductible. Your deductible this year is $240. You'll pay for that first doctor visit. And you'll say, why do I even have this? Insurance is a gamble. You take the dice and you throw it. If you are going to be healthy your whole life and die in your sleep at 90, yeah, you don't need it. Did everybody in your family live to 90? And they were healthy. You know, you hear of those rare families. Or did everybody in your family have cardiac problems and die in their 60s and 70s, like my mom's side of the family? You know your family history, unless you're adopted. And even knowing your family history, you'll say, well, my family all died young, but I'm healthy. I don't smoke. I'm not overweight. I exercise. It's still a gamble. You're still taking the dice and you're still rolling it. If you can afford to buy a Medicare supplement, get it. A lot of people say, why is Plan F not being talked about here? All my friends have an F. My parents have an F. F is no longer for sale. The Obama administration sunset it. So unless you were eligible before January 1st of 2020, you can't buy an F. F used to be the Cadillac plan. the plan we went to for 50 some years. Now G is the plan. The difference between an F and a G, as you'll see later, is just that with a G, you pay an annual deductible that you didn't have to pay on an F. If you're tired of watching the video, you don't want to learn more, and you know you want our help, we have a great team at the Medicare Family. 3 generations of my family have been helping people like you with your Medicare insurance decisions. We're licensed in all 50 states. So if you want to talk to us right now about your situation, prices in your area, would you qualify because you're over 65? Just go to our website, themedicarefamily.com. Click on the yellow box, book your free appointment. No obligation. Our services are free to you. We're independent contractors for over 30 different insurance companies. So if we help you enroll in a plan, they pay us. You don't pay extra for our services, meaning you can't just call them directly and save money. So why not get professional help at no cost? So if you're still staying with me, that means you want to learn more. And I said again, F and G are the plans you're going to be most familiar with that you've heard your friends and family talking about. F's no longer available. G, as you can see, has all the same benefits as an F. A lot of people feel ripped off. They're like, well, I want an F. My so-and-so has an F, and I want an F. You can't get an F, like I said, because they sunset it. People that have it can keep it. Now, if you have an older spouse or parent that has an F, and they're healthy enough to qualify for a G, please call us. Book an appointment on our website, because it's often cheaper to move from an F to a G, even though you have to pay the Part B deductible. This red dot here represents the deductible you'd pay each year. For 2024, that's only $240. It's just less than $300 maximum. After your deductible, you will pay $0. That's it. So if you have a Medicare Supplement plan and you have open heart surgery, how much do you pay? You pay your monthly price, you pay your deductible, and that's it. You pay $0. If you're in the hospital for 10 days, $0. If you're in the hospital for 3 months, $0. If you have a transplant, if you need dialysis, you have an amputation, if you have severe complications, $0. You can know exactly what you're going to pay. And what we found from doing this for over 30 years is that especially women like the certainty of a Medicare supplement. With the Medicare Advantage plan, which I talk about in other videos, you have all different kinds of copays. And if you're in network and if you're out of network, you have a lot of different moving parts, and it changes every year. When you buy a Medicare supplement, they can never change your plan. That's it for life. As long as you continue to pay your monthly premiums, they can never change it. So you don't have to figure out, well, next year, how much would it cost me out of pocket if I did this and this? Nope, it will be for life. You'll pay your deductible, which does go up each year. It went up $14 from last year. It gives you some idea. How much it goes up is tied to inflation, but it's going to go up. But after that deductible, you do not pay anything. You pay $0. So this is a price example. This is for a 65-year-old man and a 75-year-old man, 65-year-old woman and a 75-year-old woman. If you want to stop the video and zoom in, you can see. But what I'm trying to tell you with this chart is that women pay less. And you're saying, well, how much do I have to pay if I get a Medicare supplement? It's going to be based on a lot of things. But number one is going to be your location. What state are you in? State laws influence the price, how expensive your hospitals are, how healthy the people are in your state. That all will impact what you can get. So in general, in 2024, a female turning 65 will say in the whole middle of the country, say Texas to Montana, the whole middle of the country, all the way over to Pennsylvania. We're going to stop at Colorado, the middle part. A female can get a Medicare Supplement Plan G for about $100 to $130 a month. It's not bad, right? It's very, very affordable. A male at about $20, $30 a month. Okay. Now, why did I say just the middle of the country? If you are in Washington, Oregon, California, you expected to pay more. Idaho, Nevada. If you're over here in New York on the East Coast, you're going to pay more. And if you're in Florida, you're going to pay more. In New York, where I said a woman is going to be $100 in the middle of the country, in New York, it's going to be closer to $400. 65-year-old female. Yeah. In Florida, add another $30. So more, but not terrible. So you can see for a woman turning 65, a Medicare supplement is very affordable. And I said, you don't have to worry about all the different things on Medicare Advantage. Am I in network? Am I out of network? How much is my out of network cost? Do I have to get a prior authorization to go to a doctor? With a Medicare supplement, you can go to any doctor and any hospital in the country. Most Medicare Advantage plans are not in network. They will not allow you to go to the best hospital in the country, Mayo Clinic. So all the reviews that talk about the best hospitals in the world list the Mayo Clinic in Rochester as the best hospital in the country. If you have some really tough stuff and you get referred by your doctor to go there, wouldn't it be nice if your insurance would allow it? On most Medicare Advantage plans, you would have to pay 100% of the cost out of your pocket. Most Medicare Advantage is not in network neither, with the Cleveland Clinic, also one of the best, with Johns Hopkins, also one of the best. So Medicare Supplement, like I said, is a Cadillac plan, not only because you don't have to worry about your expenses after your deductible, right? It's zero, but you have the flexibility to go to any doctor, any hospital in the country. You're never trying to figure out the moving networks, which unfortunately do move a lot with Medicare Advantage. The reason that is Medicare Advantage is negotiating to pay those doctors and hospitals less, to give them clients to pay, hey, take less money. And with Medicare, regular Medicare, they're getting the full amount of Medicare reimbursement. They're not getting a reduction. You can go anywhere. That is very attractive, especially to women. It seems like men are of the mindset, and if you're watching this with your husband, nudge him, men are of the mindset, I'm not going to use my insurance anyway. So I'd prefer to have a $0 Medicare Advantage plan. I don't want to pay for something I'm not going to use. It seems like most of my female clients, in the over 30 years I've been doing this, female clients are not more fatalistic. Maybe we're more realistic, that we're saying, hey, I will be using my insurance and I want the best insurance I can get. At 65, let's go back to the picture of my parents. At 65, these are my parents, Margaret and Dick Gordon. My mom, both of them, first of all, are also insurance agents and Medicare insurance agents. So my mom started selling Medicare insurance in the 80s, one of the first agents to do so nationally. So they know Medicare insurance. What do you think they chose at 65? My mom chose a Medicare supplement. My dad chose a Medicare Advantage. Like I said, very typical. They're married. They have the same budget. It didn't come down to a monetary issue for my dad. He just didn't want to spend the money and give it to the insurance companies when he knew he was healthy. My dad's a little crazy on the healthy side. He watches his blood sugar. He watches everything he eats. He walks every day. He's very, very meticulous about his health because everybody in his family died early. So he's very healthy. He didn't want to pay, for a man, $200 or more for a Medicare supplement when he knew he wasn't going to be using it. He knew he wasn't going to be using it. So now fast forward 15 years. I moved my dad to a Medicare supplement because he's getting older. He was healthy enough to qualify, and it cost him almost $450 a month. He doesn't like paying $450 a month for a Medicare supplement, but at 88, I think it's a wise decision because you're more likely to have something pop up now, right? He made it all those years and he saved all that money. My mom made the right decision because my mom ended up having lots of health conditions. Like I said, heart problems run in my mom's side of the family. She ended up having open heart, bypass. She ended up having 2 hip replacements, 2 knee replacements. She didn't know she was going to end up having all those joints replaced. And all those surgeries, she saved lots and lots of money having been on a Medicare supplement for the past 15 years. My dad saved lots and lots of money having been on a Medicare Advantage for the last 15 years. That's why I say this is a personal decision, not just about your budget, right? He could have afforded it, but how you feel about insurance, where you want to spend your money, and how you feel about your health. So like I said, how much you will have to pay for a Medicare supplement is very much based on your location, where you live in the country. Certain states are going to cost you a lot more. But also your gender. Like I said, women pay less. And if you're not in a period where they have to take you, then they can charge you more if you do use tobacco, any form of tobacco in the last 12 months. So if you need to learn more about Medicare supplements, you want to learn more about Medicare insurance in your area, what the prices would be between Medicare Advantage plans, G, high deductible G, N, or between Medicare Advantage, PPOs, HMOs, cost plans, fee for service, many different options. You have many options. Call us, book a free appointment, get a free consultation, go to our website, themedicarefamily.com. You don't pay to talk to us. Call us as many times as you need, and we will work you through the process. We will guide you. We represent dozens and dozens of insurance companies. We're not employees for them, so we're not pushing any company. We don't care what plan you buy. We just want to have a happy client. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.